everyone, it's Michelle Thomas. I am coming to you again today for part 3 in our series of mycotoxin or biotoxin illness. Today we're going to cover very briefly, because it's pretty complicated and it's more for your provider or somebody to help you understand what's going on inside of you, that you may have had biotoxin or mycotoxin exposure. So this is the portion that's called analysis and diagnosis of biotoxin illness. It covers symptoms, and that's what you may be able to relate to, but I'm just going to breeze very briefly through labs and interpretations that might get you to a diagnosis or a treatable condition conclusively from your provider. Keep in mind, most Western medicine physicians are not equipped to, nor do they deal with diagnosing mycotoxin or biotoxin illnesses. That's where you will come to us as a functional or integrative medicine practitioner, but I'm just going to run through. So in order to have a clinical diagnosis of functional biotoxin illness or mycotoxin poisoning, you need to have 6 of these 13 symptoms to go further into the investigation, meaning to justify the lab work. That can be expensive. You need to have 8 of the 13 to have a 95% certainty that you probably do have either biotoxin illness or mycotoxin exposure. So I'm going to run through them quickly. If you can identify that you've got 6 or 8 of these, it might be better for you to go ahead and reach out and let us start getting some testing done for you. So if you've got fatigue, onset of fatigue, or fatigue that's been pretty prevalent for you. If you've got weakness, aching, headaches, light sensitivity that's new, decreased assimilation of new knowledge. So if you're having just trouble processing new things that are coming to you that doesn't really seem normal, not age appropriate, memory impairment, decreased word, like you're searching for words, finding words, or your memory seems to just be changing. Difficulty in concentration that is also new or just does not seem okay to you. Joint pain, morning stiffness, muscle cramps, shortness of breath, or chronic sinus congestion that may or may not lead to sinus infections that you continuously are being treated with, or allergies. You're constantly being told that you have allergies. Allergy medicine isn't helping you, and it seems to be lingering. Coughing, excessive thirst, or even confusion sometimes, maybe getting back home or getting to places that you've been going, and all of a sudden you're having trouble remembering how to get there. Appetite swings, big bouts of hunger and then not being hungry. Difficulty with regulating your body temperature, such as being too hot or too cold and just can't quite get comfortable. Red, blurry eyes, mood swings, unusual pain. This is a unique one to mold. Is there are prickling sensations on your body, like ice picks are sticking you. People say they'll jump. They'll feel like they have an ice pick in their back, or they've got an ice pick in their neck, and it's an unusual sensation, very specific to mycotoxin illness. Abdominal pain, diarrhea, numbness and tingling, static shocks. Again, those kind of shocks or picks, they kind of intertwine with each other. Some vertigo or dizziness, trouble standing up, being very lightheaded, and an unusual amount of new frequent urination. So that's the symptom cluster analysis, and if you can identify with any of those, then maybe it's time to start looking. There's testing that goes on, and these are, I'm just going to breeze over, these are just the arenas. Genetic susceptibility, and we talked about that HLA in the previous segment, of the DNA defect that does not alert your immune system that there is a foreign body that needs to be attacked. So that is a genetic defect. There's testing that can be done on the dust in your home, and that's called an ERMI or an HERTSMI-2 test, and that tests the types of molds that make people sick in your home. There is a gene test that tests the mitochondrial or the energy powerhouse in your cell, and it can test if that energy is being downregulated or not being produced enough. There are a whole list of what are called the proteomic biotoxin effects. So it's a group of lab tests. There's about 8 of them. You have to have 4 out of 8 of them be low in order to be considered in this cluster of biotoxin markers. I won't name them individually, but There's, a scale of 4 out of 8 means that you should be looked at very seriously for mycotoxin poisoning. And there's the physical biotoxin effects. So there's the neurotoxic. There's 2 tests that you can do neuro-wise. One is called the visual contrast sensitivity testing. I'll talk a little bit more about that. The other one is a brain MRI with specific software to look at different parts of the brain that can be changed. Cardiopulmonary, so people will have that shortness of breath or that exercise exertion fatigue. There's tests that can be done to test your cardiometabolic susceptibility. And then the sinopulmonary, and there is a Marcon's test, and I'll talk about that. That is a swab that tests for pathogens in your upper nasal pharyngeal passages to see if you've got anything correlated with mold toxicity. So I'm going to talk just a little bit briefly about the each one of these things that I just mentioned above. The genetic susceptibility, and like I said, we talked about before, having that genetic defect on the 6th chromosome, and that is just a simple blood test on the HLA. The next one is in your environment, and that is that ERMI or Hurts Me Too testing. What it does is it tests a dust sample, identifies molds that have been shown to have significant impact on indoor air quality. So it's a kit that you order from a company, you do a test, and they get back with some results, whether your environment is in fact clean or not of mold. The genome test that I talked about tests your DNA to see how your innate immune system is responding, whether it's working well. The proteomic biotoxin effects, those are the 8 lab tests that are done. If 4 of them are low, then treatment is almost always started. So I won't go specifically into what those labs are, what each one means. They're very complicated and a lot of pathophysiology in them, so we won't talk about those specifically. The physical biotoxin effects on the body, the neurotoxic test that's done is the visual test. So it's the test that measures the ability of the eyes to differentiate between light gray from white. So biotoxins can affect the nerves in the brain. In this test, the VCS test identifies subtle changes in the neurologic function of that optic nerve. So that is a free test that can be done online. The next test is an MRI test. It's called a brain MRI, and there's some special software that is interpretive of if there is a problem in the brain. So there are decreases in parts of the brain that evaluate volume loss in people that have mold and biotoxin poisoning. The last is the sinopulmonary biotoxin effects, and that is the Marcon's culture that I said. So Marcon stands for multiple antibiotic resistant coagulase negative staph. So basically what that means is there's a swab that's done all the way up your nose. It's similar to a COVID test. If you are found to be positive for Marcon's, it just means that they create a biofilm in the nose, and it affects any treatment that you're being done for the mycotoxin poisoning. It can be recognized, it can be treated with swabs, and then it has to be treated. But what it can do is create endotoxins or hemolysis. It creates a slimy film that the pathogens create around themselves, so the treatment that you give is not working. Last thing, the cardiopulmonary effects. Patients need to have an echocardiogram and also some pulmonary testing if they are having shortness of breath, exercise fatigue, or anything, syncopal episodes. If you're feeling faint when you're standing up, your blood pressure is dropping really quickly, it may be pertinent to have those tests as well. Documentation is important all the way through with all of these symptoms, so it can be evaluated whether these symptoms are related to simply an exposure, or they may be related to some underlying disease process that may have been overlooked or missed. Either way, we can help you here at Revitalize Health Solutions in Palm Harbor, Florida. Give us a call, 727-342-0999. Be well.